All right. Good morning again, everybody. Welcome to the first section of today's program. We're going to be focusing on state government. And again, just to reiterate for those that might not have heard earlier, what we're doing today is based on comments we've received from the first two meetings and the additional input we've received. We've sort of put them into different buckets, and we're looking at sort of preventing abuse and neglect in group home settings. And to do that, we're looking at the responsibility of all of the key players, state government, provider agencies, frontline staff, and family members and guardians. We're looking at the responsibilities of each of the groups, as well as what we think needs to be changed, what needs to be fixed. It could be a small fix, it could be a large fix. And so what we have here, and that you can see this graphic, this was based again on comments we've received. And this is really just to get the conversation going today. And so what we would like is folks to sort of weigh in, to look at, give us your thoughts on roles and responsibilities of state government, and as well as the needed reforms. And again, after today's session, we're going to put this all together in a report. And we're going to share that draft report again with everybody again to take another crack at. And then we're going to use that report going forward for our own advocacy as well as to share with the incoming administration. So we can just open the floor right now. Thoughts about, the role of state government. Here we have, we've listed four bullets: to make policies, to enforce policies, to monitor agencies, and to review and investigate unusual incident reports. Just would welcome your thoughts. I guess we're doing the hand raising, and I think Carrie and Kyoko, you're going to help me sort of pick people because I can't see anybody.
Yeah, just a quick reminder, you can find a raise hand function in React icon. It's heart-shaped.
And if you have trouble with that, just put a note in the chat that you want to speak, and we'll make sure you're heard. But we'd love to get people's thoughts. Share your thoughts. Just spend a minute or two. We just want this to be an open conversation. Again, we're recording this. We're going to, compile all of the input we get today and try to put together a draft. So, any thoughts about the role of state government? Or if you want to just move on to the reforms that are needed. Again, we listed some here based on previous conversations about transparency, about the need for, monetary fines for policy violations, to review medication administration policies, looking at human rights committees, existing state policies. I mean, you see them here. I'd love some reaction, good, bad, otherwise, things we've missed, things that, need to be sort of worded differently.
We have a hand up, Pat Miller.
Hold
Hey,
on.
Pat, good morning.
And here we go, Pat.
You're on mute. Oh, there
Okay.
you go.
Good morning, everyone. Thanks for doing this first and foremost. So I think what's in here is really good. Under the needed reforms, though, I have like a few questions slash suggestions about how we are operationally going to make this stuff happen. Because as Mercedes said, I think there are some really good policies. It's the adherence to those policies. And how are we systematically going to have accountability measures across, state government to be able to ensure that all this good work and need for change to get this right is actually going to hit the end consumer and actually happen. And so that's one of my real concerns and questions. And when we do this, I know it feels like a lot to have such specifics in there, but I think the only way this happens is if it's in there. Like when you look at like the nursing home guidelines, for example, they're very specific with very specific account measures, with very specific incentives and consequences and fines. And I feel like it has to be the same. And so I hope that when this is looked at, there's some real specific accountability measures built in, and oversight from the responsible parties, right? So when we're talking about medication administration policies, there has to be nursing oversight in there, so, things like that. And again, I know, Paul, you and I have spoken about this, and Mercedes as well, is that in state government, there really is a role to have a very specific individual working with the governor that is very experienced and has lived experience specifically with profound and severe needs, which oftentimes when reforms happen, they don't necessarily help that community because their needs may differ from those that are not in that category. And so making sure that there is representation for that group specifically for state government, because it never ceases to amaze me every time we speak to legislators, how much they don't know about that community. And so those would be my suggestions, and I thank you for listening.
Great. Thanks, Pat. All good. All good. Thank you. Does anybody else have their hand up?
Yes, Vince. Hold on. I will. Give me 1 second.
Vincent,
There you go.
morning. You're on mute. There
Can you
go.
hear me?
Yep, now we can.
Oh, sorry. Thank you. Thank you. Yeah, I just had a couple comments about the report card, which I think is a good start, for the DHS to create transparency. And, I think the idea is to help families evaluate, is this an agency that I want to have my loved one in? But I think there are a couple improvements that I'd like to suggest. And one is that the evaluation is comparing agencies that have cameras and agencies that don't. So I think there are about maybe 13 or 14 agencies out of those 140 that actually have a camera system. I could be wrong, but that's my best estimate. But the agencies that have cameras are tremendously more transparent than the ones that don't. So the agencies that have cameras are capturing a lot more, many more incidents, and something that's initially perhaps reported as something minor, like a fall or an unknown injury, and then the cameras are reviewed, and then other things that are examples that, of abuse or neglect are sometimes found. But the agencies that don't have cameras, that's never going to be known. It's reported, if something's reported as a fall and an injury, that's where it stays, if no one else can provide a testimony. So I think there's an inequity in the way that's done, and comparing apples and oranges. And the other comment I'd like to make is that I'd like to see something more equivalent of nursing homes and hospitals, where there's a lot more information made available to the public, licensing, inspections, penalties. So in the same way that a parent or a family member wants to make a choice for, a long care nursing home for a family member, parents and families can do that with the provider agencies. Thank you.
Great. Thanks so much, Vincent. And just so everybody knows, the report card he was referring to was one put out by the Office of Program Integrity and Accountability. It's on their website, but that's what he was referring to. Thanks so much, Vincent.
Thank you.
I think I saw a chat that Yana Mermel would like to speak. She's on the phone. Kyoko?
Yeah,
Yeah. Oh, okay.
so I'll assist her.
Thank you.
And I think next is Kate DeLuca.
Okay.
Kate.
Hi, can you hear me?
Yes.
Hi, Kate. How you doing?
Hi, I'm doing all right.
Good
Apologies,
morning.
Kyoko. I thought you were waiting. I thought Yana was going first. I had two comments I wanted to raise related to state role, in addition to a, I guess, clarification question. The first would be to build off what Vincent had just brought up about the OPI report cards. I would argue that this is, as has been highlighted in other publications already, that this is not really an accurate indicator about the quality of care. It's more about like how well an agency is able basically to fulfill the task. As an example, my specific person right now is at a consistent 3-star rated agency where we are dealing with significant issues. So that's my first comment there. I do think that the metrics need to be adjusted on that because right now it's not providing an accurate picture of quality of care. The second item that I wanted to highlight is the fact that I think that there should be reevaluation about oversight of homes by the agencies. And I don't know, I apologize if this is more of an agency thing. I'm bringing it up in the state section because I believe that there is legislation related to this, but essentially managers that are managing multiple homes, we are finding that, as an example, like if the acuity is very high and the homes are not close together, essentially it means that functionally, like you have homes operating without management oversight. So there's a very huge disconnect between like what should be happening and boots on the ground what actually is happening. One more comment actually that I wanted to add is that I do think that a lot of times it is seen as safety in replying that somebody doesn't know about like an incident that happened. Like, you know, if you don't know, if you weren't there, it kind of like ends with that. I would also encourage at the statewide level to look at that not being sufficient for investigation reports, because if somebody does not know why something happened, there's a reason why. So I just wanted to say, like, we've often encountered things that, like, you know, it kind of stops, oh, nobody knows, and like we can't really go any further from there. I do think that that in and of itself should be an investigative element, or criteria for that should be worth further investigation to kind of find out why people don't know. And the question I wanted to ask, sorry for talking so much, I just wanted clarification on the consolidation of the Human Oversight Committee. I do apologize if this has been discussed previously, but that was a point that I wasn't quite clear what exactly that entailed.
Sure. Thanks, Kate. Thanks for all your good comments. The Human Rights Committee. So the way the Human Rights Committee, and we spoke about this a little bit in our last annual report. Each agency, well, DDD has a Human Rights Committee that reviews human rights related issues that are brought to attention. But an agency can also have its own Human Rights Committee instead of that. So let's say an agency doesn't have a Human Rights Committee, they'd use DDDs. Our thinking is that as well intentioned, and I think as this whole issue and process has been, I do think it needs to be centralized. That's my personal view, or our office view. It's in our report. We speak about it. We just think that there are some flaws in the process right now, and maybe more centralization might be better. Maybe one Human Rights Committee that services the entire sort of, group home community. But that's what that means. All right. Well, thank you so much again, Kate. And who's our next caller?
So next one is Lisa Hugening, and then Laura Skarsky, and followed by Ronnie Del Vicino and Kathy Freeman.
Okay, great.
Okay. Hi.
Hey, Lisa.
How
Nice
are
to see you. Good.
Nice to meet you too. I just wanted to talk about also, I would love to see more policy made on these issues, but one of the things that I think is important is that if there's policies made, that these policies get reviewed over time, because things are forever changing, and sometimes policy can fall behind and get antiquated, especially when it comes to technology and various safety measures that we may not know now, but maybe in the future. So it would be a very important part, I think, for if there's policy put in place, that there's somehow written into the policy that it gets reviewed every so often, so these so important updates can happen, or if there's an emergency or things like that. So I just wanted to say if policy does get put in place, we don't want it to get far behind, 10 years from now, it be outdated and it's not being reviewed and updated and so forth. So,
Great. That's a great point, Lisa. And I remember you made me think when I was mayor, we used to always say like government is a work in progress. Like, because today's policy might not make sense tomorrow, and you
Yeah.
need to constantly be revisiting these
Yeah.
policies.
So
Absolutely.
something
Yeah.
could be put in to make sure that that happens because with all everybody always has good intentions and it's going to happen and a lot of times it never does. So.
Yeah. Absolutely. Good. Thank you.
Next is Laura Skarsky.
Hey, good morning, Laura.
Hi, Paul. I don't know if my cameras come on or not, but sure.
Not yet.
Um, Thanks for hosting this. I think it's really needed to get everyone's feedback. My son has lived in residential care for a bunch of years. We've actually been through several different agencies and different homes, and we've had a range of experiences. But I will say that when we had a situation where his group home um, was responsible for significant areas of abuse and neglect. Um, it was a very frustrating process. They kept telling us is our hands are tied, our hands are tied. Like we can report it, we can tell the agency what we see, but you know, they would basically interview the staff. And if the staff were not transparent about what happened, and to be fair, sometimes they were. Sometimes they would report on each other, sometimes they would report on their managers, but oftentimes management would not be transparent. And sometimes that's because those manager directors were never really on site. And part of the reason the home had so many issues is because, that level of oversight wasn't taking place, but they were not transparent with that. And I think this is a question like policies. I do think we need better policies. I think we definitely need more. There needs to be a better way that there's skin in the game here, right? There has to be consequences because in my child's case and the case of other people in his house, the agency just kept saying, we investigated, everything's fine. We investigated. Every now and then a random person would get let go and said, well, they were the problem, so we're just going to fire them. But the reality is oftentimes that person wasn't even involved in the incident. They just were the scapegoat, and the agency just kept doing what it was doing because it knew it could. And thankfully, eventually they actually got disbanded, which was hopeful. But it took a long time. It took several years for that to happen. And in the meantime, there was more than one house at risk. And so it's really, I think, a whole message from the top down that there's got to be accountability. And I think at each of the levels of conversation we're having today, I think it's figuring out how to hold each level accountable. Um, And I think having one of the comments I really like to make in response to the blueprint is that there has to be a lot more transparency with family members or the individual themselves if capable. Because one of my frustrations is we filed UIR after UIR. We wouldn't even know if the UIR got answered, like if it was decided it was nothing, if it was decided it was something. Supposedly our sport coordinator could tell, but they often couldn't get the information either. And it would just go into a big black hole. And that's very frustrating for families who are, working very hard in many cases to try to keep their loved ones safe. And there's just not there's just not the system isn't set up to tell the parent what is going on. I understand there's HIPAA, there's privacy, but to some extent, like there has to be some mechanism for tracking status of cases, for letting families know where their status is and why. Like if something is not considered a significant finding, why? I think parents are just not, and whether whoever is doing the reporting, there's no response back.
Yeah, thanks so much, Laura. Yeah, certainly accountability, like you said, on everybody who's involved, government providers, families, frontline staff, everybody who's involved, and transparency. It's something we talk about all the time in our office. There's no better sort of confidence building measure than transparency. And there's no way to sort of, create distrust than to have a lack of transparency. So yeah, thank you very much for your comments. Really appreciate it.
Paul, I have Yana on the phone, and
Sure.
I'm going to let her speak next because she's not in the United States, and so she couldn't come in directly. So here you go, Yana. This is our back door.
Good morning, Yana.
Thanks so much, Mercedes and Paul. I appreciate it. Can you hear me okay?
Yep.
We can hear you.
Yes.
Oh, okay, wonderful. So obviously I've spoken on the topic a number of times already, so I'm not going into the usual commentary I provide, but I'll give my feedback specific to the blueprint draft, if that's okay. So I want to say that it is important to include also the role of the individual served, even if for, aesthetics, so to speak, right? Like, because I think that just needs to be first and foremost defining the role, right? Because in that we have such a huge range of need. And I think it would be important just kind of setting the tone for the document to include that role. Next, I'm just going to go from the top. Roles and responsibilities. Make policies. So when I think policies versus law, to me, there's a critical difference. The government may have a policy to protect the rights of individuals with disabilities, but that is too broad. So for the purpose of this discussion, I think it's very important, and I'm in a way echoing Pat's comments, to make sure that this blueprint includes more precise verbiage, right? So laws versus policies, right? And in that, we're directing the government, we're directing to whomever this or potentially will be listening to this, really to have a focus on not just saying abuse and neglect are wrong, right? That's terrible. But what are we doing practically about this, about fixing this? So laws, not policies. Next, again, enforce policies, enforce laws. Monitor agencies. So under that, I wrote, provide licenses, modify licenses, remove licenses, provide quality assurance across industry. So again, sort of defining, giving more definition, leaving the ambiguity out, because, and again, this is a great discussion. We're all in the same space. We're voicing concerns. But I think, how do we reach to the next level? And that's specifically with precise definitions. So we need to define, and actually, if anybody read my comments from last night, I took the survey. A lot of it was, we need to define, and sort of like broad concepts. The review and investigate unusual incident reports. Investigate crimes when they occur. I think oftentimes these allegations are not just somebody's phone was left, and I'm speaking about my daughter, this is a specific case, her phone was left too high on the shelf, so that is a violation of her right. Possibly, of course, I like the sensitivity there, but I think we're having this call because of the onslaught of criminal activity really that's happening, right? So these are crimes, and crimes need to be investigated. And I know there'll be a segment on this later on today. I'm just not sure if I'll be able to dial in. Needed reforms, transparency of policies for provider agencies, especially for public and personal money spent in medical records. I'm adding here transparency into activities, care, food consumption, medication administration for individuals served, right? So again, it's drilling down. We need to look at that primary role of the individual and dissect sort of all functions of the day, every need they could possibly have, and see how government could have a hand in that. Medication administration policies, be more specific, too vague. Implement third-party nursing oversight, state oversight, including the centralization of the Human Rights Committee. Again, too vague. What does state oversight mean? Paul, you answered that question earlier. Thank you. Arguably, state oversight is presently in place. But again, everybody on this call knows that it is deficient. Existing state policies, again, I would call them laws. Policies also could imply internal regulations like agencies' internal policies. Quality of and the criteria for inspections to include the quality of life measures, including well-being, health, and happiness of individuals. Again, here too general, needs to be specific. quality, speed, transparency of abuse and neglect investigations. Here, the bigger question is investigations done by who? And Paul, you and I have been in discussions on this. Many people are pondering exactly with whom does this responsibility lie. So that's, I'm guessing the discussion on that is to come. And what I'm adding here also, we have laws in place, right? We have the Stephen Kamina's law. We have the HCBS rule, federal rule. It's the application. It's the enforcement of the guardrails that already do exist. And of course, it's adding additional legislation, like the Billy Cray law, of course, the nursing oversight bill with amendments. And lastly, for this segment, making the registry public, speaking back to transparency, it's transparency across the board. When I hear the word transparency in this context, I think of cameras in the group homes. I think of making financial statements, the P&Ls of these agencies transparent, public, and of course, transparency into investigation. Okay, thanks. Hopefully I didn't take too much time.
No, great. Thank you so much, Anna. Appreciate your thoughts on all of those topics. Really do. Thank you.
Okay, thank you.
Thank you. Next is Ronnie Del Vecchino and followed by Kathy Freeman.
All right.
Hi, Paul.
Good morning.
I have to say that was very informative, what I just heard, and I really don't want to repeat too much of that because she hit so many great points. My main, a lot of concerns here. One of the things that Vincent had previously spoke about, and I hear it again, cameras. We have worked with our son with several different agencies, and I can tell you that 2 of those agencies did have cameras. Cameras are great, but the problem becomes who's watching? Who is watching those cameras? Who's looking at it? What kind of oversight do we have? Because there was lots of levels of abuse and neglect in the homes with the cameras right there. And I had to bring it up to them. So it was, it's not just a matter of saying, yes, we have cameras, and because they have cameras, they're more transparent. Not really. That's not what I found at all in at least 2 homes. But I think the way to fix that would be to find out, okay, who's watching the cameras and who's providing that type of oversight. And again, when we're talking about oversight, I like what she had said, that you really have to define it, really fine tune it, because oversight is used too easily just to cover things. And then again with our son also, we had a lot of reportings of what's going on, abuse and neglect. He's nonverbal. A lot of the IDD individuals, we really have a more scary time with them because they can't speak to what is happening to them. And again, who is providing that oversight? That's important. And also when there is reporting, I really feel it shouldn't be an in-house thing of the agency, of the provider agency. I think, like, if anything happened anywhere else, in a store, in anywhere, you have the police investigating. You have an entity there that it has nothing to do with the provider agency. It's a separate entity. I think that's the way it should be treated, along those lines. If you want to do your own one, that's fine. But we need someone. We need to establish an agency. I know I've been listening a lot to what is it called? Urgency of Now, where they discuss similar things about this. And I think it's very important that we look into outside entities, establish an outside entity or agency that looks into these allegations, that questions everyone, because it isn't enough I can tell you, I know Laura had mentioned it also. I never got answers at all. I never got answers on about 8 or 10 reports. And this is not only just provider agencies, private provider agencies, but also developmental centers. And a lot of them stand behind HIPAA laws and then COVID laws, like you can't go into a person's room or because of the COVID precautions. I think a lot of that they were able to get away with quite a bit. And we lived through that. So I think definitely getting into transparency and accountability, but also having outside entities come in and do these investigations or oversee these investigations. Thank you so much. This is very
Great. Thanks so much, Robbie. It's good seeing you and good hearing from you. Yeah, transparency, accountability, it's sort of common theme that we're hearing. And to your point and to Tiana about investigations, again, this is something we think is just central to sort of fixing this, if you will. And some of us have been looking at the New York Justice Center for the Protection of People with Special Needs as a model. Some have been looking at like maybe doing housing investigations in the Attorney General's office, or maybe some kind of hybrid. But I think many, if not all of us, can agree that something needs to change fundamentally. And I think we're heading in that right direction. But these comments are great. Thank you.
Thank
All
you.
right, Kyoko.
Next is Kathy Freeman.
All right, Kathy. Good morning, Kathy.
Hey, I am going to echo some of the comments that are already made, but I think what we're talking about is independent oversight. And I recently had some questions that I've asked DDD, and apparently, they only seem to oversee the state regulations, that there really seems to be no oversight of the compliance of the state and federal laws, which is what you're hearing, actually. So the other problem I see is something you've pointed out, Paul, over and over, is the power of the provider. So therefore, if the state is not going to oversee whether these providers are following state and federal laws, and I'm talking civil rights and human rights, the other thing, like I said, I'm seeing is I don't think providers in their consents should require a guardian to waive their loved one's human or civil rights in order to get services. And what I'm seeing in these consents is actual state and federal law that they're requesting a waiver. So, say for HIPAA, that if records are sent to the wrong person, they're not taking any responsibility if that person were to then distribute information. Private property, personal belongings, they're not taking any responsibilities. So again, the human rights issue is a key. So also to these internal grievances, honestly, if we're not monitoring whether or not the providers are following state and federal law, what is going to stop them in a grievance to say that they're going to continue to do it? That's a real problem. So that's it. I mean, I obviously agree with Pat and with Yana and many of the other comments, and I think you're hearing a very common theme, but what really is distressing me now is how can a provider ask guardians to waive rights, civil and human rights, in order to get the services, because they require you to sign the consents.
Thanks, Kathy. Thanks for spending some time on that important topic. Appreciate it. And I know you and I will talk more also.
Okay, thanks.
Thank you. Thanks, Kathy.
Thank you. Next is Dottie Blakeslee.
Dottie, welcome back.
Yeah, I just wanted to reiterate what Kate DeLuca said early on, and a number of other people have said. We can't have any investigative process conclude that there were unsubstantiated allegations, especially when there is a person who has been hurt. So I think we clearly have to have an enhanced process that investigates why something happened, because it just can't end there. We learn nothing if we say, well, couldn't find someone to blame.
Yeah, thanks, Addie. That's such an important point because, yeah, investigations are important for accountability, but they're also can be really invaluable tools for educating all of us. Uh, and I don't think they're not comprehensive enough, and they don't sort of take it to that level. And I think we really need to do that. It's an excellent point.
Next
All
is
right.
Linda.
Hi, everyone. I'm I'm inserting
Oh,
myself. Oh, can you hear me?
yes.
Okay. I'm inserting myself here between state government and provider agencies to say to the council that perhaps we should add here group home lobbyists as an entity in which parents would like to see reform. Uh, Group home lobbyists, there are three major groups. They charge their members, who are provider agencies, a fee, sliding scale based on the size of the provider. They have money, access, and the ability to persuade at the legislative level and at the state level. And they have publicly, so it's not a secret, in writing, disagreed with and actively blocked safety measures parents have wanted over the years, including cameras in group homes and some other things as well, many other things. In fact, one group home provider lobbyist recently at a public meeting stated that families are providers' competition. And families don't feel that way, but apparently this group's providers do. So I mentioned actively blocking. So I think we have to have some verbiage around this and some discussion. And also in terms of accountability and transparency, one of the providers has had Bellwether as a member, and now they have Friends of Cyrus and Benchmark as a member. And there has been no insight or any verbiage about what are they doing with those members. How do they feel about those members? Are they still members? Are they harboring the members? Are they representing the members? So I think we need to add provider lobbyists and have some thoughts around that. Thank you.
Thanks, Linda. And it's a good point. The provider membership organizations that you referenced, maybe we should, the next section, provider agency, sort of include that as part of that conversation. What role they have and, any changes that maybe need to take place. Thanks. Appreciate it. All right, Kyoko, who's next on the line?
I don't see anyone raise their hand. Oh, here's Dottie.
I think it's important that families know what ways they can make their voices heard. They need to know when a piece of legislation is on the floor for comment, so they can either submit comments or go down in person to testify. They need to be able to know what organizations there are out there that can amplify their their thoughts. This forum is really fantastic because we are able to hear so many voices, and these are people who have true experience and have thought about it. They've lived it. They know what they're saying, but families need to know where they can be a voice and for change.
I think that that's an excellent point. Maybe again, maybe the right place for that is in the family members and guardians section, but
Oh, yeah.
you're absolutely right. I mean, we all know, I'm sure all of us here agree that the voice of the individuals and voice of families is the most important voice, and too often it's left out of the conversation. There's no seat at the table for us, and we need to figure that out. And maybe that's something we can talk about. Uh, maybe during the family section. I'm just thinking
No,
out
you're
loud.
right. You're absolutely right, Paul. I just sort of lost track of where we were on the agenda, but that would be the better place to talk about that.
Yeah, but definitely good. Thanks, Dottie. Thanks as always.
And
Anybody
Vince,
else's comments? Oh, I'm
yeah,
sorry.
Vince is next.
Thank you. Can you hear me?
Yes.
Thank
Oh,
you.
hey, welcome back.
Yes, just in reaction to some of the comments about oversight from the Attorney General's office. And what I'm hearing is the need for something like an Inspector General. Because right now the Attorney General is investigating, the criminal division of criminal justice is investigating incidents that are also would be, that are in the system. And they're also Division of Criminal Justice also has a fraud unit that now is interested in any possible Medicaid fraud. So it sort of makes sense to me that there would be a civil entity and like an inspector general that would work hand in hand with the Attorney General's Criminal Justice Division within the Attorney General's office. Thank
Great.
you.
Yeah, thanks for that, Vincent. Uh, yeah, good point. I don't know if we have any other comments, but since we have more time, again, even if you've spoken before, like Vincent, come back into the conversation. Love to hear reactions from what we've heard already. Kyoko,
Dottie,
Dottie?
you're muted, Dottie.
Yeah, I've heard Vincent speak a couple times and sharing comments in forums, and I think his comments are very valuable. Just taking his last comments further, we need an entity at state government that can act as an immediate enforcement entity, not just the investigation, but to immediately assess penalties and take action. Right now, in group homes anyway, if something happens, there's an investigation process, then that starts with, in most cases, it starts with the provider investigating itself, goes through a few steps, and then there's a plan of correction, and then they have to decide whether, they have to assess whether the provider does implement a plan of correction. But and then ultimately, the Department of Licensing can choose to yank that license. But we need something in between that's more immediate and something that the provider actually knows will happen immediately. So, an assessment of some sort of fee for egregious actions, something that immediately gets reported back to that provider's um, uh, board, I think is helpful to know that a person's that that a provider needs to be answerable because things will happen quickly.
Absolutely not. I couldn't, agree with you more there. I mean, not only do we need to fundamentally fix the investigations process, but there needs to be accountability. There needs to be repercussions, for those bad actors that continue to act badly. Right now, we were struck in our office a couple of years ago to learn that there are absolutely no financial penalties imposed on an agency in the children's system or the adult system who does bad, who doesn't follow a corrective plan of action. And again, from what it's worth, our perspective isn't, you should be fines on any mistake that's made. But for those that are persistently making mistakes, those that are making egregious mistakes or allowing abuse and neglect to happen, they should be penalized accordingly. Absolutely. I think Yana, you're up again.
Yep, I've got Yana here. Okay, go ahead.
Okay, hi. I just wanted to follow up on the recent comment specific to the Attorney General's office already having sort of the role of investigating criminal cases pertaining to the IDD population. In my personal experience, that is a complete misnomer. So I think most people in the general public, most citizens of New Jersey would assume the same. If a crime occurs and the crime happened against any citizen or any resident of our state, the Attorney General's office would investigate that crime should it rise to the level of their involvement, right? If it's a heinous enough crime. I'm here to tell you that is not true. That just simply doesn't happen when it pertains to our population. And I have tragically lived that when it came to my daughter's case. What happened to my daughter were crimes. They were essentially crimes. And if she were just a neurotypical resident of our state, and if she were not disabled, I have no doubt that the Attorney General's office would get involved. Just sort of the extent of abuse, right, and the extent of injury sustained would warrant that. Just by the mere fact that she has intellectual and developmental disability, that she is disabled, her crimes actually never reached the Attorney General's desk. So, because in our case, the police and the prosecutor's office basically said, we will defer to DHS and DCF to make their investigations. And if they deem that crimes indeed have transpired or have been committed against your child, we will then loop the Attorney General's office in. And as most of us on this call know, most of the investigations actually end up being unsubstantiated. So unfortunately, we never received justice for what happened to my daughter. And I'm here to tell you that all I want at this point is to get justice for what happened to her, and to make sure that families like ours, families of individuals who have become victims of abuse, receive justice. And I much rather see that come out of an entity, of an agency that deals with the criminal aspect of investigations. So again, just want to speak to the point where it's an assumption that most residents of our state think that if a crime occurs, it does get handled by the Attorney General's office. And I'm here just reiterating that it's simply not true. Thank you,
Great.
Mercedes.
Thanks, Yana. Thanks again. Appreciate it.
Thanks, Yana.
And thanks, Mercedes, for your assist.
So the order of next speakers are Kathy Freeman, Michael Bertram, and then Lisa Hugarin.
Hi.
Yeah.
I just wanted to, I mean, it seems like we are saying the same thing. And I know the model that you are looking at is the New York justice system, but many of us have kind of looked at their reviews and kind of questioned how effective they are and the problems that they have. And to Yana's point, as far as AG and criminal prosecution, you know, as far as I heard about Friends of Cyrus and also the Beata nurse that were arrested for abuse, with Friends of Cyrus, it was a coworker that called that a witness of abuse into the police, and that is why that person was arrested. In the Beata nurse case, that nurse was working in a home, and the family had cameras and saw the abuse and reported it to the police. So, as we've pointed out, there's a real disparity between how abuse and neglect is reported, how it is found, and the lack of prosecution for our population. And since medication administration has come up, and this is part of the state government, one of the things I just want to point out to the listeners is that in the bill, we're hoping 5416 as far as requiring certified medication aids. We're also would like an amendment to clarify that the nurse could be remote. Obviously, many of the providers are concerned about the cost of hiring nurses. But what we're looking for is nursing oversight that can be remote. And also, too, that a healthcare provider, a nurse would be available 24/7 to DSPs to consult for things when they should go to urgent care, if they have a concern about behaviors or symptoms or things like that. And that is something that we really want to put in that bill. The New Jersey State Nurses Association wants to see this passed. We don't understand why there's no parity with our population receiving nursing oversight of medication administration when it's not required, when it is required in every other licensed facility. All parents are aware that even you couldn't give your child a Tylenol to go to school. It had to be administered by an RN. And the fact that assisted living and nursing homes all require some sort of oversight, it is really concerning for the nurse. And if you're not aware, nurses cannot oh gosh, I'll lose my train of thought. Cannot delegate to someone who's uneducated, uncertified, and that what providers do isn't verifiable. Therefore, nurses will not oversee the DSPs right now. God bless you if you're in an agency where you have nurses that do that. But quite frankly, they're risking liability of their license for what the DSP may do that they're aware of. So I just want to clarify, people listening, that we would like to see some amendments to that bill that would only require a remote nurse who oversees that those DSPs, and also 24/7 coverage.
Great. Thanks again, Kathy. Really appreciate your inputs.
Okay, no
Thank you.
problem.
Who
Michael,
else we got?
Michael
Michael?
Bertrand?
All right, Michael. Morning.
Unmute. There we go. Thank you. What I'd like to see is us getting some of the same response out of the legislature that like the education industry does. One of the problems we had was people that were being investigated for abuse of students would resign and move to a different employer, different school district. So we got the state legislator to pass a law that's called Don't Pass the Trash, which requires everybody to ask for a reference and requires the last employer to disclose if the person left while they were under investigation for abuse of a student.
Mhm.
They're also constantly monitoring what is going on and passing laws to control the education industry that I think would be very applicable to ours.
Thanks, Michael. Those are good points. And, maybe something we should consider, actually, I was just looking at the chart. We don't have, we have state government on here, and the assumption is it's the executive branch. But maybe we should have state legislators on there too. Thinking, maybe particularly there's a role, and I'm just thinking out loud, for the Legislative Disability Caucus to play, a more active role or something. So anyway, good food for thought. Thanks, Michael.
Lisa Fuganin?
Oops. Yeah, hi. I just wanted to just follow up on, you were talking about, Paul, you were talking about penalties and especially monetary penalties and things like that. And having, previously worked for enforcement at both federal and state levels, not in developmental disabilities, but in health and safety, a lot of times what was happening was the penalties were so low that it was cheaper to not comply than to actually comply. So you never really had compliance because it was just, it was a drop in a bucket for a lot of these places to actually comply. So that would be one of the things, is to make sure that, there's something that has enough strength to actually get people to comply, as opposed to, them being able to just say, it's not worth it. I'll just hire a lawyer and I'll do whatever, or I'll pay it. And it doesn't matter. So that was one of the things that and it still happens, that frustrates me. It's just cheaper to sometimes not comply. So there's no incentive for compliance.
Yeah, it's an excellent point, Lisa. It reminds me, again, when I was mayor, we had one business in town that would constantly violate a certain law we had in town. but they saw it as the fine they had to pay is a cost of doing business, so it was worth them to do it. But so you're absolutely right. It's, like anything, I think it's about striking the balance. Again, we don't want to be too draconian, and we don't want to punish agencies that, might have had a mistake here or generally do good. But we also don't want to let the bad actors sort of get away with acting badly. So it's striking that balance like anything. Thank you. All right, Kyoko.
And Christine Bachter.
Christine, back.
Here I am. Thank you. I was actually asked to read a statement from someone who'd like to remain anonymous and who doesn't have access to the Q&A.
Okay.
Families are struggling to confirm whether UIRs are being filed by residential provider agencies. When they are, families often hear that internal investigation was unsubstantiated, but there is no clarity on whether a state investigation occurred. When the state does investigate, the findings often lack transparency. Is there a plan to increase state oversight of UIRs and ensure families are notified by the state anytime a UIR is filed, regardless of the reason? Also, are there any plans for third-party investigations to occur? Typically, in many of these situations outside of our population, police involvement would occur. And that's it.
Great. Thanks for reading that, Christine. And thank whoever submitted that. Appreciate it. Kyoko.
And Dottie.
All right. Welcome back to the show, Dottie.
I know I'll stop after this. This is
No,
just a
not at
very
all. Not at all.
okay.
All good.
This is just a very specific ask or statement, whatever. There is an investigation that's done after every event of mortality. There is a board that's convened and a study is done. However, I don't know where that report goes because there seems to me that if there is effort putting in actually investigating something like that, then why not share this information so we can learn from it? I mean, I just don't understand why it's so closely held.
Yeah, absolutely, Dottie. Again, going back to your point you made before about transparency, it's so invaluable. Again, not only is it educational, but it can just, it can, build trust, if you will, which is so important. And we definitely need to pursue that. So thanks. Kyoko.
So that's all we have for, Kate
Oh,
DeLuca.
Kate. All right, Kate.
Sorry, I'm slow to unmute.
No.
I wanted to add one quick point. Another thing related to UIRs, I understand families, we get letters essentially saying what the outcome was. I would also think that ostensibly, like, families aren't permitted access to this outside of a court order because basically, like, we want to encourage providers to be transparent in what they're filing and not thinking that, oh, if it's subject to review to, it's essentially, I feel that that's meant to encourage it, but we're seeing that that's not the case. I would also say that as part of a policy consideration to see about, at the very least, if UIRs could be categorized into what can be released to families.
Right.
Having to go through a court order in order to obtain one.
Right. I think that's an excellent point. One of the things we talked about, we've had some meetings with our office, and others have meetings with the folks at the New York Justice Center, which I referenced before. Again, just as a potential model, just to try to figure out how they did it. And for those of you who don't know, the New York Justice Center was created, opened its doors in 2013, and it was created following a New York Times sort of investigative series about abuse and neglect in their system. So we've had many conversations with them just to sort of get their lessons learned. And, we talked to them about their reports and stuff. And they were, I don't know, shocked is the right word, stunned, surprised, when we pointed out that how hard it is for families to get investigative reports in redacted versions of investigative reports. Again, it speaks to that educational transparency, confidence building, that we need in our system. So thank you. Thanks for that, Kate. Anybody else, Kyoko?
No, I don't see any hand raised. We have 18 minutes. Just a friendly reminder, so you can raise your hand in React icon. It's heart-shaped, or you can type in the chat box.
All right, Dottie.
One of the things that I find continually frustrating is um, uh, this this automatic assumption that you know what? I just realized what I was going to say, Paul, falls in the provider agency group, and I'm very sorry about it. I'm just concerned that providers have this automatic response, and maybe it's not. Maybe families assume that it's there, that certain things need to be held confidentially, things like Mars, which doesn't really make a lot of sense, especially if you're the legal guardian. But I guess what I'm trying to figure out is whether there is a possibility of the state setting clear rules that basic things like Mars or medication management or financial management, things that clearly fall into the guardianship or parent role um, are just required to be provided to a parent or guardian. Right now, if you ask an agency to give the Mars, they will say, I don't really have to give it to you. Or, and I have to say again, in my case, my daughter's program, immediately let's open up the book and take a look. All right. So the reaction varies. So some guidance from the state to make it clear, what the rules of operation are, I think would be helpful.
Absolutely. And, providers, like people, everyone's different. And, we work with a lot of providers, and I would throw them into the category of really good providers, really try to do the right thing. Uh, and I would imagine many of them would agree with your point that there needs to be more clarity, there needs to be some, very specific rules and regulations, encouraging that kind of transparency, because they do it on their own, but they know that other agencies are not doing it. And there needs to be some we need to level set, and we need to sort of raise the bar. Uh, we do have these conversations, Christina and I, all the time with different provider agencies who really, really try to do the right thing, but they want to raise the bar on the rest of the industry, if you will. And they look to, they look to the state to sort of establish those rules and policies. So everyone sort of is playing by the same rules and policies. Absolutely. Thanks, Dottie.
Paul, there's been a lot of activity in the chat, which is great because people are sharing things that are helpful. But Christina Mizell asked if her comment could be addressed, so I'll just read it because it was hard for me to find it. Maybe others can't find it. It says, to piggyback off of something Kate said earlier, it's confusing for the rights of the individuals when there is a high acuity in the homes, and not all individuals are able to receive all services because they are understaffed, and it's unfair to commit to both individuals. Shouldn't there be more staff to accommodate all needs? I think it's an excellent point. It might fall under provider agencies, but there's also state accountability in terms of overseeing that people with acuity have the services and supports they needed. The agencies are appropriately staffing those agencies. You want to say a little bit more about that, Paul?
No, I mean, I agree. I mean, again, I think, we need the policies, we need the oversight from the state, and then the providers need to sort of follow suit. So I think it's one of those comments that sort of fits in both buckets. But there's a responsibility. Again, I say this, and I always say the onus is on us. I'm in state government. We make the policies. We make the regulations, and we need to hold people to a high standard, and then enforce those policies. And then part of enforcement is, if you will, imposing perhaps financial penalties on those that don't follow the policies. So yeah, that's definitely one that we throw in this bucket, but also sort of spreads into the provider agency bucket too, I think.
So I'll just encourage people that if you have something you're putting in the chat and you'd like us to call it out, please just say that. Again, I see a lot that's statements and reactions, which we won't read all of those, but if that's another way to communicate something you'd like to contribute and have read aloud, we'd be very, very happy to do that. Just let us know.
And Mercedes, a question, in addition to the recording of this meeting, are we going to be able to have that chat sort of print off of
Yes.
that chat?
Yes, we will capture
Okay,
it in the chat.
that's great.
I think we have Pat.
Anybody else?
I saw Pat Miller's hand up and it went down. Pat, did you still? I don't know where she went.
Sure. Yeah, I'm here. I realize it's really under the next category, but I guess they're a little blurred. So, when we go back to talking about the systematic change and perhaps the providers and group homes who are doing this well, is there an opportunity here to really take a look at the guidelines? Because, I know we've talked about this in other listening sessions, but it's the variability amongst these providers that, lends itself to problems, right? And so is there an opportunity here to revisit those guidelines and see if there's a way to make them less open to interpretation? Because, most recently I spoke to a provider who I believe is doing a really good job from the visits I've seen. And, interestingly enough, the people who run these group homes are nurses. One worked in nursing homes for over 20 years. And so there's a real background in systematic, policy guidelines from a health agency. And so they're doing the right things. And I think there's an opportunity there to see, well, if this provider is able to do this, how do we take a look at these guidelines with a critical hat and say, this is too open to interpretation, which is leading to, variability, which is leading to risk of abuse and neglect, right? And so it kind of going back to the preventative piece of this rather than the reactive piece of it. And I really do think that falls under state government, but it also falls under provider, because right now it's too wishy-washy. It's too easy for providers to say, well, I'm checking this box, but I'm not really doing the right thing.
No, I agree. I would put that mainly in the state government because, right, we
Okay.
need to establish the criteria. And you reminded me, there was a family we've been working with for several years, first in the children's system, and then they were transitioning into the adult system. And I was struck because the father contacted me after looking at 4 group homes. And he went on, he said the first two different agencies, he said they were excellent staff, the way the place looked, everything. He had so many good things to say about the first two. And he said, and then I went to the other two. He goes, I can't believe it's the same system. He goes, the houses were disgusting. The staff were barely there. It's like, how can this be the same system? And that's what we need to address, to your point.
Okay, Paul, I'm going to read from the chat again.
Thanks, man. Appreciate it.
Linda Thomas writes, we need a registry and criminal penalties for organizational executives who allow abuse and neglect. No one was ever punished from the bellwether shutdown. They are still in the industry.
It's an interesting and good point. The only penalties we have right now are on frontline staff. It's Danielle's law, which is also embedded in Stephen Camino's. We need to hold the agencies accountable, and the agency leadership. Again, I always have to caveat this. We're not talking about across the board. There are a lot of great agencies doing the right thing, but there are some that are not, and we need to really clamp down on that.
I have Yana Mermel back on the line. I thought I saw a hand up and then down. So Kyoko, can I go to Yana?
Yes.
Okay.
Thanks, Mercedes. Just wanted to follow up on what Pat said. Families are in the position of sort of being beholden to these agencies, right? Like being too afraid to speak out. In the application process, oftentimes it feels like it may be harder to get into a good agency than, say, into an elite college, right? If we have neurotypical kids, right? So I have recently heard of a family applying to an agency which advertises that they take tier EA, they support tier EA, and yet their child was rejected because she was too, high of a need, right? So we also need to reach a place where it's not so much on the agency to make that ultimate decision, right? If they are receiving funds from the state and if they advertise themselves to be able to take care of a particular tier, in this case, tier EA, then it should be a lot more difficult for them to reject a potential client, a potential individual served. And that goes hand in hand. It should be a lot more difficult for the agencies to discharge a client, right? So nobody wants to be in a situation where they are unwanted, right? we're all aware of those situations where it's just such a toxic relationship. And it is for the best of both parties to disengage. But I will say that it seems to be a very uneven balance here of who is in control. And certainly the families are not in control, or often don't feel that they're in control of their loved one's future, So it really sometimes feels like on a day-to-day basis that you're either blessed to have a roof over their head and care provided, or you could be looking at, searching for the next best placement and being turned down. So I don't know exactly which bucket that fits into it, but I just wanted to voice this concern.
Thank you. I would think that would probably go in the family bucket, but there's probably a piece of it, a lot of this is overlapping. When I was listening to Jan, I was remembering, I think it was our 2020 annual report. We put in there sort of a section about how families are treated in the system. And we sort of called for, like, I don't know if what family bill of rights, sort of, just the way families are treated and engaged in the system. Again, some providers do it all the time. They're very family friendly. They recognize that an individual's family is a tremendous resource. Not only do they have a right to be part of the conversation and be central to it, but they're a great resource. But others don't, and we really need to change that. We need to sort of give families more agency and make sure that they're central to all that's happening.
And Paul, going back to the individual budgets and the tiers, there's another comment by Kathy Cambrillo in the chat that also when there are individuals with varying budgets in one home, the question is how is the home differentiating the supports for each individual? Because the fear is that the budget goes into one big pot and then everyone is supported at the same level, regardless that, and I'll add to that, regardless that the individuals are tiered specifically with a budget that is akin to their needs, that aligns with their needs, that the sense is that when the money all funnels through the door of that home, that everyone's treated under one umbrella, one budget umbrella, if you will. And there isn't the differentiation between the needs of one person living there versus another. So I think that's really state government role to monitor and
I don't
um
know.
go
I don't
ahead.
know. I mean, I think they should. I mean, this is an issue that we deal with all the time. Christina and I deal with all the time, and we raise with folks in DHS is, somebody who has, significant needs. They might have, let's say, an EA budget because of behavioral needs, but that $520,000 is not being spent on that individual. It might be being pooled, and that individual's not getting the support. They're not getting the behavioral interventions that they need and deserve. So I think there's probably a role, again, one of those overlapping ones. It's both state and provider that we need to look at.
So we have 3 minutes, Paul.
That's it.
Yeah, I
All right.
know that went really fast.
Is there
Um,
another comment or anything
um,
left?
we've
Otherwise, we could just wrap up.
Vince, Kathleen, and Kate who all have their hands up. They've all had an opportunity to speak. If you want to each take, 30 seconds to
And Mercedes, I'm sorry for interrupting. Like I saw Paula Solomon raise her hand. She hasn't spoken. Would you like to speak?
yes.
Yes, I'm sorry, I just raised my hand because of what you just said, Mercedes. I was waiting for the provider agency section to come up, but what you just talked about with the amount of the budget being spent on the individual as opposed to being spread out. I have brought that up many, many times to, I'll call it the administration of the agency where my daughter lives, because I feel that they are not providing her with the proper quality of a DSP. She is deaf, and I have been asking them to definitely look for supports that are obviously going to have to be paid more, because I would like them to be able to communicate with her in her primary language. And they do not seem to be doing this. And when I question what they are doing with her budget, and she is an EA, they in some way almost accused me of saying, well, do you think we're not using the money for her, that we are using it frivolously on other things? And this is a big concern of mine, and it's been a concern of mine for quite a while now.
Yeah, Paula, thanks for raising that. Feel free to reach out to our office.
I have. I've reached out to your office, I hate to say it, 2 or 3 times, and I get a quick response, but then it gets dropped. No one has ever continued a conversation with
Oh,
me.
I'm so sorry about that. Yeah, we'll look for your contact information and reach back to you.
Thank you.
Yeah, absolutely.
And
Thank
we're
you.
glad you came today, Paula.
I am too.
Thank you. And we're gonna take that 5-minute break, Paul.
Yeah.
Everybody can stretch, get a cup of coffee, maybe two.
Yeah, let me just thank everybody. This has been a
Yeah.
really great conversation and a really great start to today's program. And just want to thank you all for doing it. And again, to remind you, if you have additional thoughts on the government and the state government piece, submit them in writing to us, and we'll definitely factor everything in. So thank you so much. Appreciate it.
So you don't have to go anywhere. You can stay here. We'll be back in 5 minutes.